So we need that vitamin D and calcium for developing fetal bones and teeth. Other nutrients that are going to play a role in that are phosphorus, magnesium, and fluoride. Calcium needs for a 19 to 80-year-old female are 1,000 milligrams, and adolescents 14 to 18, their needs are going to be a little higher at 1,300 milligrams. Calcium absorption, interestingly, doubles in pregnancy. Um, so the recommendations of the 1,000 milligrams of calcium are intended to conserve mother's bone mass while supplying all the fetal needs. And another interesting fact is in the final 3 weeks of pregnancy, about 300 milligrams of mom's calcium from her bones are transferred to babies. So I say it over and over when we're talking about pregnancy and just the events that occur, just what a miracle it is and how all these boxes are checked to assure that the baby is entering this world as healthy as possible. Iron is another nutrient that we hear a lot about with pregnancy. Again, iron needs are increased because of the increase in blood volume. If mom has an early iron deficiency in pregnancy, that low birth weight, having a baby less than 5.5 pounds, that chance increases by 2 to 3 times. And again, babies born to moms with iron deficiency, and I want to clarify there, I'm talking about a diagnosed iron deficiency, not somebody that's not meeting their iron needs, for a few days or a week or so. This is someone with a diagnosed iron deficiency. They have lower intelligence, lower language skills, and lower attention skills. So during pregnancy, iron needs are increased to 27 milligrams per day. Mom can get iron from red meats. Those are going to be the most absorbable type of iron, that heme iron. But we can also get iron from leafy greens, nuts and seeds, raisins, dried fruits. If mom is deficient, then oftentimes it will be required for mom to have a supplement. And we have some dosing information here. We want to take between meals or before bed. Why? Because the absorption of that iron is inhibited by calcium foods, tannins in tea and coffee, and then phytates in whole grains. So we can get the best absorption on an empty stomach that will help with the absorption of iron. So prior and during pregnancy, again, mom wants to choose foods that supply heme iron, and then foods that enhance iron absorption. You all know from Nutrition for Dietetics that pairing a high iron food item, with an item that is rich in vitamin C increases the iron absorption. So for example, if mom's going to have a salad as a meal and have some sirloin steak on that salad, adding some orange, mini tangerines or mandarin oranges or strawberries or red and yellow peppers, something that's going to have a lot of vitamin C, will help mom use that iron more efficiently. The fetus's iron supply is regulated by the placenta. So the fetus gets priority over that of the mother, which, again, another fascinating piece. Here's just some numbers for the definition of iron deficiency anemia, looking at both hemoglobin and hematocrit, and it's going to differ in the trimester that you're in. And recall from Nutrition for Dietetics that a normal hemoglobin is about 12 to 15 grams per deciliter, and a normal hematocrit is about 36 to 46% level. We don't want to overlook zinc. We need that for DNA, RNA synthesis. A deficiency could predict lower birth weight in the baby. Zinc is found in many protein foods, meats, nuts, seeds. Mom should be given a prenatal supplement, and the prenatal supplement will have more iron and more folate than a regular old multivitamin. Again, we talked about B12. Let's revisit that.